Is it narcissism or is it just ADHD? My name is Dr. Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing neurodivergent affirming care. And one of the common misdiagnoses that can happen either in the office with a clinician or at home with a partner or other loved one is that of narcissism and ADHD. And the reason for this is that there are certainly a number of overlapping symptoms. So both narcissists and people with ADHD can appear self-absorbed. They may not seem to be listening or understanding the perspectives of others. They can be dominating in conversation and ignore the needs of other people. They can also both act really impulsively, and there tend to be a lot of relationship issues associated with both diagnoses due to some of these shared and different behaviors. So what are the differences between them? How can we tell them apart? So of course, ADHD is a neurodevelopmental difference, which means that the way that the person's brain functions is just different from what we have deemed to be neurotypical. This means that we would have seen symptoms from early childhood. There would have been issues in school with learning and inattention, behavioral issues probably. Now, we do not diagnose any personality disorders until patients are at least age 18. But of course, there could be some symptoms of this going on in childhood as well. But of course, there are often symptoms of this that are existing in childhood. And there can be issues with getting in trouble, behavioral issues at school because of this, less likely to have specifically learning issues. Another way that they differ is in motivation. So in ADHD, their behavior is probably not very intentional at all. They have trouble managing focus, they're impulsive, they're distracted. In contrast, people with narcissism tend to feel that they're superior. They have a need for admiration. Now, I will say that both of these diagnoses can have pretty low self-esteem and or be very sensitive to perceived rejection from others, right? So with ADHD, we call this rejection sensitivity dysphoria. And with ADHD, this usually stems from lots of little criticisms that the person has experienced starting from early childhood to the point that they're just hypersensitive to anything that might be a criticism. Narcissism, of course, it's gonna have different root causes, right? Maybe they weren't loved by their mother or their primary caregiver, or they had some other early childhood trauma. But this is kind of where a difference comes in as well, because with the person with ADHD, they're very highly aware of this experience. They can be very self-critical and eager to seek help. Whereas with narcissism, they tend to be less aware. They're not seeking feedback, they're not seeking help, and they don't really see what they may have done that was wrong. Now, what appears to be lack of empathy can also be shared amongst these two diagnoses, but people with ADHD, they do really care, and it may just be due to their distractibility, whereas those with narcissism genuinely lack empathy and see their interactions with others as pretty transactional. Of course, the behavior is going to be a significant difference. With people with ADHD, you're going to notice that hyperactive behavior, fidgeting, always being on the go, forgetfulness, those executive functioning issues like working memory and time management. Whereas you're not going to see this as much with someone who has narcissism. They're more manipulative, exploitive, can act entitled, and they're rarely going to apologize for being late, as opposed to the person with ADHD who is chronically late and chronically feels terrible about this. And then of course, treatment is going to be different between them. With ADHD, there are coaching and other behavioral techniques that are really helpful. And of course, we have medications that are pretty helpful as well. Whereas with narcissistic personality disorder, a medication is definitely not going to take this away. And it is also pretty challenging to treat in therapy as well. But it's not to say that therapy cannot be helpful for these individuals, because it absolutely can. But of course, it's also important to keep in mind that these two things can occur at the same time. If you've had any experience with being diagnosed as either one or the other or both, then I'd love to hear about it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I'll see you in the next one.